All right, thanks. So I'm Bennett. I'm a PhD student at Northwestern University. So as part of AIM's summer workshop on the dynamics and data of the COVID-19 pandemic, I worked with fellow PhD students Laura Albrecht and Paulina Charnetsky to work on investigating the relationship between air quality and COVID-19 transmission. So there's a great deal of research being done right now about things that affect the transmission of COVID-19. However, most of it revolves around human behavior, like the impact of closing schools or wearing a mask. In fact, relatively little research is being done on ambient environmental factors. However, there's lots of evidence that short-term exposure to air pollutants can contribute to transmission of other respiratory illnesses, such as the flu. One pollutant in particular that can affect viral transmission is called PM2.5, which is defined as particulate matter less than 2.5 microns. So in fact, there was a study based in Beijing that used a statistical model called a generalized additive model, or GAM, to find that an increase in PM 2.5 leads to an increase in flu cases. So we took our inspiration from this paper and tried to build a GAM to understand COVID. Okay, so what is a GAM? So a GAM is just a type of generalized linear model that estimates the expected value of a response variable as an additive function of the predictor variables. So here we have this template equation. Y is your response variable following a given distribution. X1 through Xn are all of the predictor variables, and S1 through Sn are the smoothing splines. And G is just the link function linking the predictor space to the response space. So here is a table of all of the data that we were considering for our model. So I should say that we concerted our efforts on Italy, which is a country that was hit pretty hard by COVID pretty early, and it acted uniformly to disrupt the spread of the disease, and it kind of prioritized widespread testing. So we used data from 23 provinces noted by these stars. So in Italy, provinces are about the equivalent of US counties. So in each of those provinces, we looked at daily COVID cases and tests, as well as Google mobility data, specifically the percent increase in people staying at home, as well as air quality variables and other environmental variables like temperature and humidity. So as we're starting to build our model, there are a couple of challenges that arise just by looking at the data. So one is scaling between population sizes. So some of the provinces are a lot bigger than others. For example, Rome is about 20 times the size of the province of Rimini. So 1,000 cases in Rome means something a lot different than 1,000 cases in Rimini. And then another pretty big challenge was we wanted to I guess there was a big lag between the day that you actually get exposed or infected by COVID and the day that you get a positive test result back. And it was really important for us to know the day that you got sick because we want to look at the environmental variables on that day. So to confront these challenges, we had to choose our response variable pretty carefully. So instead of just using like a case count, we ended up going with the effective reproduction number, also called the instantaneous reproduction number that was explained really well in the last presentation. So it's also called RE or RT or R effective or R instantaneous. And it's just the average amount of people that one sick person is expected to infect. And it varies with time. And so the way that we calculated this was we used this open source model called rt.live. The link's up here. And rt.live kind of has two ways of how it works. So the first thing is that, so you provide in a time series of positive tests, basically, and then it uses an empirically driven onset delay distribution to try to turn that time series into a time series of infections on the day of infection instead of on the day of positive test result. And then it uses another PDF for generation time, which is just a probability distribution that describes the time it takes for one person to infect others. And it it uses that to determine our RT. So here we just have a visualization of all of the data that we're using. So I should say on the x-axis here, we have just date. So these are all time series. We started in February 24th for all of them and ended on August 1st. And so on the y-axis is going to be the value of the variable in the title here. And each line is colored according to the province. So I guess the thing that I really want to highlight about this is just looking at the RE plots. So for all of the cities, they started up pretty high and then quickly went down. That corresponds with lockdown, which happened on March 6th, I believe. So it went down really quickly and then maintained a sort of decreasing or started leveled out throughout lockdown and then started creeping up when lockdown was lifted back in May. And then a lot of the clustering that you'll see here comes from geographic proximity. Cool. So here is some more data. So this is the mobility data from Google. Similar to the last slide, the x-axis is going to be time from February 24th to August 1st. And on the y-axis is the percent change in baseline in all of the mobility variables that Google had. So there were 6 of them. For this project, we mainly focused on this pink one, which is just the percent increase in people staying in residential areas. And these dashed lines, I should note, are where lockdown happened. So it started here and ended here. And when it started, there's this big increase in percent people staying at home, and it's sort of starting to get back to normal by now. So here is the formula for the GAM that we ended up using. So we have RE as our response variable and log as our link function, and then our predictor variables, the ones that ended up being statistically significant, are this mobility percent people staying at home variable. There's PM 2.5, temperature, and humidity. And then here are the visualizations of the GAM, basically. So on the x-axis here, you will have the predictor variable and the value of that. And on the y-axis, it's just the effect on log of R of E. So to read this, for example, when you have fewer people staying at home, then you will expect RE to be a lot higher. And then as people start to stay home more and more, this number goes down. And there's kind of a nonlinear relationship there where it goes down more quickly and then kind of plateaus. But the thing that I really want to highlight about this this plot is that is this PM 2.5 square down here. So we see that the effective PM 2.5 really starts to take hold when PM levels are above 70. And you see like this kind of linear relationship with the log of R of E. Whereas below 70, it really doesn't have much of an effect at all. And this is actually in really good agreement with some previous results. So from the flu paper that I talked about in the very beginning, when we were looking at PM 2.5 versus flu transmission. So these on the left here is the result from that. And on the right here is our result. So so this study was done in Beijing, and they have a lot wider range of PM 2.5 values. So we really want to focus on the red box, which is what we have data for Italy. And as you can see, it's a really, really similar relationship where PM 2.5 doesn't have much of an impact below 70, and then it starts to increase pretty linearly.
All right, 5-minute warning.
Okay, cool. Okay, so I'll move on to these tests for robustness that we did. So the first thing that we did was we used this model on each province individually, just to make sure that the same trends were present. the same variables were statistically significant. And then we removed one province at a time and fit the model with the 22 remaining provinces, and then tested it on the one province that it wasn't trained on. So just lastly, I'll show what that looks like. So here we just have two examples, Rome and Bolzano. So the Rome plot over here, so the black line is the true value of RE, and the red dots are what are predicted from the model. As you can see, it lines up really close, especially at the beginning. And then there's a little bit of disagreement at the end there, but overall it follows mostly the same trend. Bolzano also is pretty good at the beginning, but then it's a lot worse than Rome. So some of our current work is looking at why. One reason could be that Bolzano is a lot more rural than Rome, and just like differences in the culture there and the population density. So lastly, I just want to acknowledge some people. As I said at the beginning, this was a project from a workshop at the American Institute of Mathematics. So I'd just like to acknowledge our advisors there. So there's Dick McGahey, Mary Silver, and Mary Zeman, as well as Doug Nitschka and Jack O'Brien. Thanks.